When your doctor orders a test, you just trust the result, right? But what's really behind that trust? Today, we're going to pull back the curtain on the system that's designed to make sure every single one of those lab results is spot on and reliable.
It seems like such a simple question, doesn't it? But the answer? Well, it's way more complex than you'd think. It's not just about the expensive machines or the folks in the white lab coats. It's about a really strict, standardized process that guarantees quality from the very second a sample is taken to the moment that report lands in your doctor's hands.
And this quote right here, it gets to the very heart of the matter. I mean, even with all the incredible advancements in medical tech, just making sure the quality is consistent has been a huge challenge. An incorrect lab result, that can lead to a wrong diagnosis, the wrong treatment. You can imagine the serious consequences. So how do you even begin to solve for quality across a massive public health system?
Well, to understand the solution, first we have to really appreciate just how big this issue is. Lab services are, and I mean this, absolutely critical to modern medicine. Just think about it for a second. We've gone from a world where doctors had to rely almost completely on what they could see and what a patient told them, to a world where they have cold, hard data to back up a diagnosis, to see if a treatment is working, and to manage a patient's health long-term. Accurate lab results are the absolute foundation of that entire data-driven system.
So, to tackle this quality problem head-on, India's Ministry of Health and Family Welfare rolled out a really comprehensive framework. And here it is, the National Quality Assurance Standards, or NQAS for short. It was launched way back in 2013, and its mission was to create one unified system to improve, and this is the key part, to sustain a high level of quality in public health facilities, especially the labs.
And you've got to understand, this isn't just about handing out a new rulebook. The real goal of NQS is to fundamentally change the entire culture inside the health system, to make quality and safety just an automatic, baked-in part of every single thing they do.
So how in the world does NQAS do that? Well, it takes this huge abstract idea of quality and breaks it down into pieces you can actually manage and measure. The whole framework is built on what they call 8 areas of concern, or pillars. You can see them here. They cover everything from patient-facing services and the core lab operations to safety, management, and of course, the final patient outcomes. Together, they give you this complete 360-degree view of what a high-quality lab looks like.
What's so amazing is how practical and down-to-earth these standards are. Like, take patient rights. The assessors are checking for real, tangible things. Are the signs easy to read and understand? Can someone with a disability get in and around the facility without any trouble? Is there an actual system for complaints? Are they always getting consent? It makes this big idea of rights very concrete.
And that same hands-on approach goes for safety too. Under infection control, the system is checking the basics that protect everyone, patients and staff. Are people actually washing their hands? Is the PPE being used the right way? How are they handling hazardous waste? These are the absolute non-negotiables for a safe lab.
So when you add it all up, across those 8 pillars, you've got 50 different standards, which then break down even further into 170 specific measurable things. This creates an incredibly detailed checklist that leaves almost no room for guesswork. A lab either meets the standard or it doesn't. Simple as that.
Okay, so a lab has this massive checklist. How do they actually go about proving they meet all these high standards? Well, that brings us to the certification process itself. This official flowchart shows you just how formal and buttoned up the whole journey is. It's not a simple process, that's for sure. It all starts with an application and moves through all these different stages of review and on-the-ground assessment before any certificate is ever handed out. Let's just boil that chart down, though. Basically, a lab applies and their paperwork gets reviewed. Then, a trained team comes in for a super intensive on-site assessment. Their report gets reviewed, finalized, and then sent up to the Ministry of Health, who makes the final decision and issues the certificate. It's a process with a lot of checks and balances built in.
And listen to this. The bar is set really high. To get nationally certified, a lab has to score over 70%. And not just overall. They have to score over 70% in each and every one of those 8 key areas. So you can't be great in one area to make up for failing in another. Quality has to be solid, right across the board.
Now, this next part is, for me, where the NQAS philosophy really shines. Earning that certificate, that's not the finish line. Not even close. In fact, it's really just the starting gun for a long-term commitment to quality.
A certification is good for 3 years, but it is not a pass-and-forget kind of deal. In the first and second years, the lab has to go through surveillance audits to make sure their standards haven't slipped. Then, in year 3, they have to do a full reassessment to get recertified. It's not a one-time test, it is a constant, continuous cycle.
And that's the whole secret sauce right there, sustainability. This cycle of continuous improvement is what makes NQAS a real quality management system, not just a one-off award. It forces labs to live and breathe quality every single day, not just cram for a big exam every few years. So why go through all this trouble? All these checklists, all these audits, why does it really matter? Well, it all comes back to this vision. The goal of all this work is deeply human. It's about saving lives, reducing sickness, and easing the financial strain on patients by giving them test results that are fast, reliable, and right the very first time.
So at the end of the day, when you see that an NQAS certified lab handled your test, it's so much more than a piece of paper. It represents a deep, systemic promise, a commitment to your safety and to providing you with reliable, high-quality healthcare.
And that kind of leaves us with a big final thought, doesn't it? This model of setting clear standards, actually measuring performance, and then demanding constant improvement, it has transformed public labs. The big question is, where else could a framework just like this make a real, lasting difference?